Simple tips to keep your teeth for life. With age, many lose their original teeth, and tooth loss has various causes. Some are hereditary and some are due to not taking care of them enough. Here are some simple tips, but they will help you keep your teeth for life. Dental problems, that heavy guest, make the probability of retaining the original teeth in old age very small. Among these problems is gingivitis, which occurs due to infection with bacteria, which weakens the gums and makes them unable to hold the teeth, as well as the presence of bacteria that cause tooth decay and produce acids that erode the enamel and the occurrence of holes in the teeth. Some dental diseases are hereditary, but there are some cases that are due to insufficient attention to the teeth. What is the solution? Some simple and very useful tips that we offer you here to maintain your teeth for life. 1. Brushing it twice a day. Make sure to brush your teeth twice a day for 2 minutes each time. 2. Clean teeth with precision and focus. Most people brush their teeth quickly, forgetting to clean the inner surfaces of the tooth. According to the German Focus website, dental experts advise to develop a systematic method, and it is best to start with the inner surfaces and then move to the sides and then the outer surfaces, as the outer surfaces are often thoroughly cleaned according to the opinion of the dental specialist. 3. Electric toothbrush. It is better to use an electric toothbrush, as it helps to clean teeth better than a manual toothbrush. 4. Cleaning flosses. Dental specialists stress the need to use dental floss daily, to clean the spaces between the teeth well, knowing that using floss incorrectly leads to wounding the gums. The correct way is to wrap the thread around the index fingers of both hands, and in order to hold the thread well, it must be fixed by pressing it gently with my thumb, and then the cleaning process begins. The cleaning process is not limited to moving the floss up and down only, but it must be rotated with the curves of the teeth, so that the floss is bent using the fingers in proportion to the shape of the tooth. Then clean the surface of the teeth by moving the floss from the space between the teeth. It is worth noting that those who have large spaces between their teeth, dentists advise them to clean these spaces using a toothbrush designated for that. 5. Periodic dental examination, a necessary step, especially for patients who suffer from gingivitis and tooth decay, as it is better for them to visit the doctor during frequent periods. As for those who do not have problems with their teeth, it is sufficient for them to see a doctor once a year. 6. Professional cleaning at the dentist. It is also recommended to clean the teeth professionally at the dentist several times a year. According to the Gesundheit-Tipps website concerned with health affairs, people who suffer from cavities in their teeth should have them professionally cleaned by the doctor once every 3 months. While it is sufficient to do this procedure once a year for those who do not have problems with their teeth. 7. Fluoride. Some are afraid of using fluoride to clean the teeth, but doctors believe that using small amounts of it is not harmful. There are many studies that confirm that the fluoride used in the dental industry is non-toxic, but rather protects against tooth decay and the occurrence of caries in them. People who suffer from cavities in their teeth are advised to use fluoride gel after using toothpaste, as it helps protect the teeth.